Hello everyone, my name is Dr. Ashraf, and today we are going to do a counseling session on post myocardial infarction. Whenever you have a patient who's coming in after an MI, please provide emotional support to them, address their anxiety, depression, and also focus if they have any ongoing stressors. Um, you can refer them to a psychologist or a psychiatrist to manage their emotional well being. You can also connect them to support groups so they can have motivation so that they can share their experiences and provide emotional support for each other. Um, Also, mention about lifestyle changes, especially dietary modifications. Um, Emphasis on cholesterol and blood pressure. You can advise them about Mediterranean diet, low fat diet. Also refer them for physiotherapy programs. There are special exercise programs that are tailored to one's condition, and you can let them know that I'll be referring you for physiotherapy and for cardiac rehab program. Another important thing is their adherence to medical management. So um, make sure that you tell them that you have to take your medications on time, keep a medication box, or if they need help with medication access, you can refer them to home care for MedAssist. Um, if you have time, mention them that you have to take your aspirin, your beta blocker, your ACE inhibitors, and statins. Um, Also, if they're prescribed nitroglycerine and if they're males, make sure that you are telling them the contraindications to not use medications for erectile dysfunction because it can cause severe hypotension. Um, Also, emphasis on their follow ups with a family physician as well as with a cardiologist. Um, if it's suspected or asymptomatic coronary artery disease or a stable angina, there is no restriction for driving. But if it's a STEMI or non STEMI and it has caused significant left ventricular damage, or if they have undergone CABG, so you can restrict them from driving for 1 month following hospital discharge. If it's an NSTEMI with minor left ventricular damage, and if it's an unstable angina, so you have to recommend no driving for 48 hours after a PCI or 7 days if there is no PCI performed. If they ask you about sexual activity, so it is generally safe to resume sexual activity within 4 to 6 weeks if it's an uncomplicated myocardial infarction. Thank you so much for watching this video and dedicating your time to improve your OSCE score.